I agree with you that history makes morality, and what my point about featuring crises in society is to say that that's where we are making a moral argument. We're saying, yeah, basically, you don't want and you shouldn't have a collapse of society. It is a horrible thing. Look at Darfur. This is, I think, a basis. It's not. I'm not just saying your neurons are giving you your morality like some materialist reductionists would say. I'm saying it is the fact that you treasure having people in your community that you can trust and that you want to do things for. And you can't imagine what life would be like without that. That goes as deep as I think anything goes, and that's where I think we find morality. Debbie, what is my utopian ideal? Some people have thought that maybe a good version of the National Health Service in England would be their ideal, because it's going to be so hard to disentangle the hospital system from the insurers in the U.S. of all the different roles they play. I don't think any one of these systems should be thought of as the only one and as the ideal. The National Health Service seems to be working in England. It took a new lease on life when it got some more money. It was a money-starved system that couldn't do its work without more money. The same thing is happening in Canada. The successive conservative governments tried to starve it out. It refuses to die. They keep going with it. So what happens to the insurers? That's a good question. In the HR 676, which is sort of our bill in the House, the single-payer bill in the House, what is suggested is that there be a period in which there are several $100,000 available to workers in insurance companies to retrain. Now, in addition, I think most of those people will find, I shouldn't say most, but a great number of those people will find jobs in any successor system of a single-payer nature, because they're going to need a lot of actuarial work, we're going to need a lot of computational work, and those people, if they do anything right, they know how to do those things. I think when needs to, if you're going to take care of General Motors employees in one way or another, you ought to take care of the insurance company employees. They're workers, they're people who have health care needs, and they need to be treated humanely. Chris, insurance across lines. I think that's very important. We worked too long on an old system where the states make insurance law, and that creates a lot of problems. And one thing that a single payer would do would be, in one fell swoop, change that quite a bit. It won't change it for other forms of insurance, but for health insurance. And tort reform. Tort reform is very big, especially among some medical people, and it's an important subject to be dealt with. Many different avenues have been suggested for dealing with it. I think the best thing in the world would be to have a system in which, if you screw up with a patient, that patient is going to be taken care of in further medical incidents for helping him or her by the single payer system itself. So in Canada, you have the kind of thing that you have very small amounts of money put aside for medical malpractice, and one of the great reasons for that is that somebody who has suffered at the hands of a doctor will be taken care of by their insurance. So, thank you very much.
Thank you.